My name's Professor Hazel Barrett. I'm an Associate Dean for Applied Research in the Faculty of Business, Environment and Society at Coventry University. I'm also the Principal Investigator and Research Director of the Replace2 project, which is a European Daphne III funded project, which is trying to develop a new approach to ending FGM amongst African diaspora living in the European Union. As you will be aware, there has been a lot of discussion in the UK about FGM and whether we should go for prevention or for prosecution. And at the moment, the balance is very much towards prosecution, and we currently have a case in the law courts at the moment. So the Replace2 team decided that we would have a conference to debate, if you like, the different viewpoints about prevention versus prosecution, with the view that prosecution should not be the only prevention or deterrent to people doing FGM, but the fact that we should understand why communities, normal, loving families are performing FGM on their daughters, but in the law are being branded as child abusers. And we felt that it was timely to discuss these issues and to try and explain the approach that Replace2 is taking to try and understand social norms amongst these communities and to try and implement a behavioural change model so that in fact we don't need any prosecutions. When we were planning the conference, we wanted to ensure that we had a broad array of participants, from those who have survived FGM, activists working against FGM, NGOs interested in violence against women, including FGM, as well as academics and researchers and members of communities. And we were absolutely delighted that Ifrah was able to accept our invitation and come and speak to the conference about her experiences as a Somali refugee living in Ireland and the very brave activism that she has been engaged with both in Ireland and back in her home of Somali.
My name is Ifrah Ahmed. I am from Somalia. I'm based in Ireland. I am campaigning against practice female genital mutilation in Ireland. I set up a youth club called United Youth of Ireland. The youth club, the priority is to engage with the community and raise awareness on FGM. So we educate the community on FGM and also to protect the young girls, and especially girls from age 10 to 17 who are not under FGM gone, who've been in Ireland for a very long time. We try to attract them for our workshops because we believe they are the people who are at risk on FGM. When it comes for a legal saying that if family take their child, or we are seeking to find somebody who take their child or circumcised and stuff like that, we are putting more pressure to the community, and that actually brings more risk than bringing awareness based and basic understanding and breaking the bridge between the government and the community. Because I think it's all about understanding. The community, if they are aware and they are giving workshops, they're giving trainings, they are told that this is risk, and like basic understanding, that will support. But if we are focusing only for cases, we are putting more pressure to the community, and you never know what can happen. It might even be a more risk than the workshops and understanding and breaking the bridge between the government and the community.
We're also delighted to welcome to the conference Leyla Hussein, who's one of the leading activists against FGM in this country and a founder and director of Daughters of Eve. She has been actively campaigning against FGM in this country and overseas for a number of years, and you might well know of her from the documentary that she made and was broadcast on Channel 4 last year called The Cruel Cut.
My name is Leyla Hussein, and I'm an anti-female genital mutilation campaigner. My background is in psychotherapy, and I work directly with FGM survivors in a therapeutic space. But I've also been a lead campaigner for many years, 11 years now, and I've helped co-found Daughters of Eve, and now I've set up the Dahlia project, which is the only support counselling service for FGM survivors. So that's what I'm working on at the moment, and that's why I was here today to kind of talk about the support FGM survivors need, especially those who are at the front line, who are also campaigners.
We're delighted to welcome Dr Els Leye to the conference. She's one of the world's leading academic experts on FGM, has done a lot of very interesting research, particularly on the prosecution and prevention aspects of FGM, and has been a leading player in the research community fighting FGM in the European Union.
My interest has always been on women's rights and on gender equality. Before I started at university as a researcher, I worked for the National Women's Council in Belgium. But at a certain point in time, there was a post free at the university, and I started working on female genital mutilation. And actually that was because there was a member of the European Parliament who informed us back in '97, who informed us that female genital mutilation was becoming an issue in the European Union and that they didn't have a clue what to do about it, either at policy level or professionals, health professionals, for example. So, and she also directed us to a certain funding program, the Daphne program, and that's how it started. I started my work in '97 with the first research project on FGM, and I'm still continuing. There are still issues within the European Union, in most of the European member states, issues with regard to reporting cases of female genital mutilation, and also with finding sufficient evidence to actually have a court case. These are the two main issues, I think, with the implementation of the law. I could give you much more details on the reporting, why it is so difficult. It has a lot to do with professionals involved in the implementation of the law, their lack of knowledge on FGM, their lack of knowledge on the legislation, the lack of referral mechanisms, of tools, of instruments like protocols, for example, on how to refer, on how to assess the risk of female genital mutilation. So there are a lot of issues that we could solve, actually, that could help in raising the number of reports and maybe raising also the number of prosecutions, if that is preferable.
I'm delighted to say that Norman Baker, the Minister for Crime Prevention at the Home Office, although he couldn't be at the conference, was willing to give an introduction on a DVD. This is extremely important to us and in our deliberations about prevention versus prosecution, because the Home Office is the lead government department in the UK in tackling FGM.
I'm impressed with the work of the Replace2 project, particularly in bringing together an international partnership of organisations working to end FGM in the UK and in Europe. We know that FGM is not a problem that can be solved by government alone. Indeed, the progress that we have made so far would not have been possible without the commitment of our voluntary sector partners and the frontline professionals who work on and campaign tirelessly on this issue.
Whilst this conference is really focusing on FGM in the UK and Europe, because that is the focus of the Replace2 project, FGM is a global issue, particularly in sub-Saharan Africa and the Middle East and in Southeast Asia. So we were absolutely delighted when Lynne Featherstone, representing the Department for International Development, agreed to do an address to the conference.
I believe that if we're going to make global progress towards ending FGM, then we must base our work on the best possible evidence. And I am delighted to hear that you will be bringing together researchers and practitioners to discuss approaches towards ending FGM, a practice that I believe is one of the most hidden and violent forms of discrimination against women. It is unacceptable that 3 million girls are subjected to having their genitals cut each year, and more than 125 million girls and women are living with lifelong consequences of this harmful practice.
This conference has shown that there is great interest in FGM, both in the UK, in the EU, and we feel that this conference has been very, very valuable, but is just the beginning for us in our fight against FGM. The Replace2 project is about halfway through, and we are in the process of evaluating our new approach based on behavioural change models to ending FGM amongst the diaspora here in the European Union. And early next year, we will be presenting the evaluation and our findings to key policymakers in Brussels, and we hope that our approach to ending FGM will be adopted within the European Union and that this barbaric practice will end.